Hello, my name is Joseph Navarra. I am the president of the Pharmacists Society of the State of New York. We here at PSSNY believe there is a misunderstanding and misinformation among pharmacy owners and pharmacists alike about the new reimbursement schedules for PBMs and Medicaid. Do you know what you're getting paid for Medicaid, AWP, and EPIC? As of September 26th, regardless of what your screen says, which should have been corrected by now, a new reimbursement has started. As of September 26th, the value of the AWP has been reduced by 4% with no reduction in your cost of goods. That means that Medicaid is reimbursing you at AWP minus 20.25%. This 4% reduction in AWP works out to be about a 55% reduction in your gross profit for brand name medications. This is a result of a federal court case against Medispan and First Data Bank. You need to now determine if you can do business as usual. If you do not do much in Medicaid, AWP, or EPIC and believe this video is not for you, you need to understand that New York State is negotiating with Medco for the New York State employee prescription plans to do the same type of reimbursement. This now will affect about 5.5 million patients in New York State. Also, you need to understand that you need to review your PBM contracts. They have sent you addendums and new contracts to help keep you whole in this time where reimbursement is changed. If you do not submit those contracts, you're being reimbursed at your old rate. If you do not review these contracts, you may also realize that you're not getting exactly paid what you were getting paid on September 25th. One of the reasons is that your reimbursement is based on a lower AWP. PSSNY is seeking to change Medicaid, AWP, and EPIC reimbursement methodology from the AWP methodology to a WAC plus methodology. In order to do that, we need to pass bills in both the Senate, the Assembly, and then have the governor sign off on this new legislation. In the New York Senate, a bill introduced by Senator Jeffrey Klein, S6146, was passed in one day with the hard work of PSSNY, changing the reimbursement from AWP minus 16.25% to WAC plus 5%. This does not mean that we're being kept whole by Medicaid. To pass the law, we need to pass it in the Assembly and also have the governor sign it. In the New York State Assembly, a bill was introduced by Assemblywoman DeCito, A9139, that mirrors Jeff Klein's bill. As for the Department of Health and Department of Budget, at this time they have no indication or willingness to help us or change the reimbursement to keep us whole. Other things that we are doing, we have filed litigation in New York State against Medicaid to help prevent these cuts from closing our pharmacies. We're also going to be applying for an injunction in imposition of these cuts, and that will be filed shortly. This is a joint effort from NCPA, NACDS, and PSSNY. Unfortunately, lawsuits, lobbyists, and bills need money to go forward. PSSNY needs contributions to their legal fund and their political action committee to combat these cuts. Each and every pharmacy owner, pharmacist, and pharmacy employee need to call their senator in the state where they work and where they live and thank them for voting for Senator Klein's bill S6146. Each and every pharmacy owner or employee must contact his or her assembly person where he or she lives and works and ask them to support and sponsor Assemblywoman DeCito's bill A9139 that addresses pharmacy reimbursement in Medicaid, EPIC, and AWP. Again, right now we're talking about Medicaid, EPIC, AWP, Family Health Plus, and Child Health Plus. The New York State Employee Prescription Plan will shortly follow suit, and then the PBMs shortly after that. You can use the PSSNY website, www.pssny.org, for updates and information. On the left side of the website, there is a button that says Legislative Action. You can click on the button and get all the information of your legislators in your area and their phone numbers. If you're not a PSSNY member, you need to join now, especially if you're a pharmacy owner or pharmacy employee. The reason being is that PSSNY is run by pharmacy volunteers. There are a few of us and many of you who do not belong. You need to belong. We need the membership to increase our numbers, to make us strong enough and powerful enough to affect change in the state of New York. Please send your feedback about this video to PSSNY at the email shown below, awprollback@pssny.org. If you're a healthcare provider, or a prescriber, or a nurse practitioner, or a PA that uses pharmacies to help them manage and care for their patients, this affects you also. What happens when pharmacy cannot carry certain brand name medications? What happens when pharmacy cannot do a delivery to your patients anymore? How will the outcome affect your HIV or transplant patients when they cannot get medication they need when they need it? What happens when the pharmacy in your local area goes out of business and the patient needs to walk around with a prescription trying to get their medication filled? This also affects the outcomes of your patients too. So please join us in the fight in helping save pharmacy. This is everybody's fight. It is all our businesses at risk and our jobs are on the line. We'll be providing other videos in the future with updates on our crisis. Thank you very much.